Myself, Dr. Mayuri Mahajan. I am MD Microbiologist from AFMC Medical College, and also Diploma Pathologist. I have done DPB from CPS Mumbai. Today we are going to discuss the microbiology part of CBT examination. Going towards the first question, the microscopic image LCB mount shows septate hyphae with conidiophores ending in brush-like structures or broom brush appearance. The organism is dimorphic fungus and commonly seen in HIV/AIDS patient. Producing a diffusible red pigment in the culture. Identify this organism. So looking upon the image, this is very typical of penicillium. Now the name of the penicillium has changed to Telleromyces marnefi. Earlier it was Penicillium marnefi, and that is the one of the most commonest fungus found in HIV and AIDS person. So the appearance is very typical, and it is one of the most found dimorphic fungi. Going towards the second question, Will-Felix reaction is most useful in serological diagnosis of which of the following infections? Among all the options, we can go for rickettsial infections. It is typically using OX19, 2 and K antigens of protease and used for diagnosis of rickettsial infections, scrub typhus and all. Going towards the third question, all of the following are characteristic features of Vibrio cholerae except it is coma-shaped gram-negative bacillus, it is oxidase positive, it is non-invasive organism, and lactose fermenter on McConkey's agar. So out of all this, D is the option. It is non-lactose fermenter on McConkey's agar. Question number 4. A 62-year-old man develops profuse watery diarrhea, abdominal pain, and fever 7 days after starting clindamycin for a dental infection. CT abdomen with contrast shows marked colonic wall thickening with contrast trapped between swollen haustral folds. Which is the most likely causative organism? So amongst the options provided, the clinical picture is typically of Clostridium difficile associated diarrhea. The clues provided in the question are the patient is on antibiotics in 7 days and marked colonic wall thickening. So we can land up to the directly to the option of Clostridium difficile, antibiotic associated diarrhea. All of the following Clostridium species are non-capsulated except this is typically Clostridium perfringens, which is capsulated Clostridium. Question number 6. A 28-year-old male with a history of rheumatic heart disease presents with fever for 3 weeks. Blood cultures grow Streptococcus viridans in 2 separate samples. Echocardiography shows a mobile mass attached to mitral wall. Which of the following best establishes the diagnosis? Given in the question are 2 criteria. Blood cultures grow Streptococcus viridans in 2 separate samples, and echocardiography has shown the mass or the vegetations attached to mitral wall. So the 2 major criteria are met here. So option is C. Going towards 7th question. In the 3rd week of typhoid fever, which diagnostic test is most likely to be positive? Here we can remember one mnemonic of Basu. B, that is blood culture in 1st week. S for stool culture in 2nd week. S, that is stool culture that continues to be positive in 3rd week. And D, U is for the urine culture which comes positive in the 4th week. So in question which is asked is in the 3rd week of typhoid fever, which of the diagnostic test is most likely to be positive? So among these options we can go for this stool culture. Coming towards 8th question, a clinical sample is stained using a modified Zn stain and then decolorized using 1% of H2SO4. Which of the organism will remain acid fast after this level of decolorization? Mycobacterium tuberculosis is acid as well as alcohol fast. Mycobacterium leprae is acid fast with 5% of H2SO4. Cryptosporidium parvum oocytes, it is also positive but with 0.5% of sulfuric acid, and the option C, that is Nocardia species, is typically positive with 1% of sulfuric acid. So here the answer is Nocardia species. Ninth, a patient develops severe generalized muscle spasms after exposure to contaminated wound. The toxin produced inhibits the release of GABA and glycine from inhibitory interneurons in the spinal cord. Which clinical condition is most likely? So seeing all the options, the answer is C, that is tetanus. The toxin released by this Clostridia inhibits this GABA and produces continuous spasms. Question number 10. A 22-year-old woman presents with high-grade fever, vomiting, diarrhea, and diffuse maculopapular rash and severe hypotension. She has been using tampons during menstruation. On examination, she has conjunctival hyperemia and disclamation of palms and soles is noted after 48 hours. Which of the following is most likely cause? Coming on to the clinical criteria and symptoms of the patients, we can opt for Staphylococcus aureus producing toxic shock syndrome toxin 1. We can easily appreciate multisystemic involvement along with the disclamation of palms and soles. And typically the use of tampons is associated with Staphylococcus aureus infections producing toxic shock syndrome toxin. 11th question, in a figure given the growth which is showing yellowish colonies, culture plates shown demonstrate translucent yellow lactose fermenting colonies on blue-green medium commonly used for urine cultures. So which is this medium? So typically McConkey is pink color medium, TCBSA and clade and XLD. So this is clade, cysteine lactose electrolyte deficient agar, which is typically used for urine cultures, which inhibits growth of protease and shows colonies of lactose fermenting organisms like yellow, which is depicted in this picture. The 12th question is Loeffler's serum soap is used for, this is a selective medium, and this selective medium is typically used for Corynebacterium diphtheria. Question number 13. A child with bloody diarrhea is suspected to have Shigella infection. Which culture media is most appropriate? This is again from a selective medium. So selective media for Shigella is xylose lysine deoxycholate agar. The other media used are selective for other organisms, but this is typically Shigella typically grows on XLD agar,